Welcome. Today we learn how to take a patient's medical history. A good history helps doctors and nurses give safe care. Sita, what is a medical history?
A medical history is a record of a patient's past and current health. It includes illnesses, medicines, allergies, family health, and sometimes social details.
Good. I will show you the main parts. We use simple questions and listen carefully. First, always start with patient identification and the reason for the visit.
What details do we take for identification?
Ask full name, age, date of birth, sex, and contact details. Also ask who brought the patient and if the patient has a legal guardian. Then ask, why are you here today? Or, what is your main problem?
After the reason for the visit, what's next?
Next is the present illness or chief complaint. Ask when the problem started, how it began, and how it feels now. Use simple questions. When did it start? Is the pain sharp or dull? What makes it better or worse? Ask about the severity and pattern. This helps form a diagnosis.
What about past medical history?
Past medical history includes previous diseases, surgeries, hospital stays, and childhood illnesses. Ask, have you had this problem before? Have you had any operations? Also ask about major chronic diseases like diabetes, high blood pressure, heart disease, lung problems, or kidney issues.
How do we ask about medicines and allergies?
List all current medicines, including over-the-counter drugs, vitamins, and herbal remedies. Ask the name, dose, and how often. Then ask about allergies, medicines, foods, or materials like latex. Ask what happens if they are exposed to the allergen, for example, rash, swelling, or trouble breathing.
What is the family history for?
Family history tells us about illnesses in close relatives, parents, siblings, and children. Ask about heart disease, cancer, diabetes, high blood pressure, or genetic conditions. This helps predict risks for the patient.
Do we ask social and lifestyle questions too?
Yes, social history includes job, living situation, smoking, alcohol use, and exercise. Also ask about travel, pets, or work with chemicals or radiation. For radiography students, ask about pregnancy or possibility of pregnancy in women of childbearing age before imaging.
How do we ask about the review of systems?
A review of systems is a quick list of questions about body systems. General, fever, weight loss, heart, chest pain, lungs, cough, breathlessness, stomach, nausea, pain, nerves, headache, numbness, and more. Use simple yes/no questions. Do you have a cough? Any trouble breathing? This finds other problems that the patient may not mention.
How do doctors use this information?
Doctors use history to make a working diagnosis, decide tests, and plan treatment. For example, a clear history of chest pain and risk factors may lead to ECG, blood tests, or urgent care. Medication lists help prevent dangerous drug interactions. Family history may suggest screening for certain diseases. Social history guides patient education and discharge planning.
How should we communicate with the patient?
Use clear, short sentences. Speak slowly. Use simple words, not medical jargon. Make eye contact and show respect. Use open-ended questions first. Tell me about your symptoms. Then use closed questions for specifics. Is the pain worse at night? Use teach-back sometimes. Ask the patient to repeat key points in their own words.
What about privacy and documentation?
Always protect patient privacy. Only share information with the care team and with permission. Write the history clearly in the patient's record. Use the patient's exact words when useful. Accurate notes help other team members and make safety checks easier.
Any tips for difficult cases?
For patients with language barriers, use an interpreter. For confused or very sick patients, ask family members if allowed. Be gentle with sensitive topics like mental health or abuse. If the patient is tired, do shorter history sessions and return later for more details.
How long should a good medical history take?
For a focused history, 5 to 15 minutes is common. For a full medical history, it may take longer. Always be efficient but thorough. Safety and clarity are most important. Let us practice. Sita, you ask a patient about current medicines. Rizal, note what you hear.
Now that you have listened to the lecture, let's check your understanding with some open-ended questions. Comprehension questions. 1. What are the first questions you should ask a patient when starting a medical history? 2. Name 3 items included in the past medical history and explain why each is important. 3. Why is it important to list all medicines and ask about allergies? 4. How does family history help doctors in patient care? 5. Give 2 examples of social history questions and explain how the answers can change the patient's care. 6. Describe 2 communication tips for taking a medical history from a patient who is an English language learner. For further reading and a deeper understanding of how medical history taking supports accurate diagnosis and guides clinical decision-making, you are encouraged to consult the academic source listed below. This reference provides detailed explanations, structured approaches, and practical examples that will help healthcare students and professionals strengthen their skills in patient assessment and communication. Academic reference: Bickley, LS, 2021, Bates Guide to Physical Examination and History Taking, 13th edition, Walters, Kluwer. This textbook explains the structure of the medical history, communication skills, review of systems, and how clinicians use patient history to guide diagnosis and management.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.